Hello, and thanks for joining me. Today we're going to talk about the top threats to men's health. My name is Melanie Stevenson. I work at Loveless Health Plan as a health educator coordinator in the Outcomes Medical Management Department. A little bit about my background. I have a bachelor's degree in exercise science from the University of New Mexico, and I'm also a certified personal trainer through the American Council on Exercise, which some of you may know as ACE. I've worked in cardiac rehab settings, aiding in behavior and lifestyle modifications, as well as heading and developing worksite wellness programs and curriculum. I really enjoy providing information and presentations like the one we're here for today, so let's go ahead and get started. Let's review a couple of important things. The presentation is going to last somewhere between 45 to 60 minutes. If you have any questions about anything, please feel free to email us at healthysteps@loveless.com. You can expect to hear back from us within 48 hours. We won't be taking any questions during the presentation, so if a question comes to mind, go ahead and jot it down and email it to us. We really want your feedback about the presentation and to know how we can support you in the future, so please complete the evaluation you'll receive after the presentation is done. Sometimes there's a delay in the slides or audio may become scratchy. If for any reason you get disconnected, don't worry about it, just go ahead and call back in. So the topics we're going to be covering today include heart disease, cancer, injuries, stroke, COPD, type 2 diabetes, flu, suicide, kidney disease, and Alzheimer's. So let's start by talking about heart disease. So the term heart disease refers to several types of heart conditions. However, the most common type in the United States is coronary artery disease, which can cause a heart attack, angina, which is a medical term for chest pain, heart failure, and arrhythmias. So heart disease is the leading cause of death for men in the United States. In 2006, over 315,000 men died from it. So this means that heart disease killed 26% of the men who died in 2006. So that's more than 1 in every 4. Half of the men who died suddenly of coronary artery disease had no previous symptoms. And somewhere between 70% and 89% of sudden cardiac events occur in men. In the United States, the most common type is coronary artery disease. If you're diagnosed with coronary artery disease, you may have an angioplasty or coronary artery bypass grafting. Both of these procedures help restore blood flow through narrowed or blocked coronary arteries. So let's go ahead and talk about what a heart attack actually is. A heart attack, or myocardial infarction, occurs if the blood supply to the heart muscle is cut off. So just to be clear, your heart, as I'm sure you're aware, is a muscle. Unlike other muscles, it has arteries that lie across its surface which deliver oxygen and nutrient-rich blood to the muscle. So if circulation is blocked to an artery, either due to plaque buildup, vasoconstriction, or even a blood clot, then cells in that part of the heart muscle don't receive enough oxygen and they begin to die. Plaque buildup can cause angina, the most common symptom of coronary artery disease. This condition causes chest pain or discomfort because the heart muscle doesn't get enough blood. So over time, coronary artery disease can weaken the heart muscle, which may lead to heart failure, which is a really serious condition where the heart can't pump blood the way that it should. An irregular heartbeat or an arrhythmia can also develop, and the more time that passes without treatment to restore blood flow, the greater damage to the heart. So the 5 major symptoms of a heart attack in men are pain or discomfort in the jaw, neck, or back, feeling weak, lightheaded, or faint, chest pain or discomfort in your arms or shoulders, and shortness of breath. So most men with heart disease have at least one risk factor, and many men have more than one risk factor. Certain medical conditions like lifestyle choices can put men at a higher risk for developing this often deadly disease. These conditions and habits include high cholesterol, which can be controlled with diet, exercise, and medication if needed, high blood pressure, which again can often be controlled with a diet high in fruits and vegetables and low in sodium and saturated fat. High blood pressure can also be controlled with medication if needed. Diabetes drastically increases one's chance of developing heart disease. Type 2 diabetes is in most cases preventable and is triggered by an unhealthy lifestyle. So type 2 diabetes can be prevented by maintaining a healthy weight and by eating healthy fruits and vegetables and exercising regularly. But we'll get into type 2 diabetes more in a minute. Cigarette smoking increases the risk of coronary heart disease all by itself, so it's an independent risk factor. When it acts with other risk factors, though, it really increases your risk for developing heart disease. This is because smoking increases blood pressure, it decreases your exercise tolerance, and increases the tendency for blood clots. Smoking also increases the risk of recurrent coronary artery disease after bypass surgery. Obesity rates, obesity raises blood cholesterol and triglyceride levels, and it also lowers HDL cholesterol, which is your good cholesterol. HDL cholesterol is linked with lower heart disease and stroke risk, so the higher your HDL, the better. So reducing your HDL tends to raise your risk. Overweight and obesity also raises blood pressure levels and can induce diabetes. In some people, diabetes makes these other risk factors much worse. The danger of a heart attack is especially high for these people. So poor diet combined with physical inactivity can lead to obesity, abnormal cholesterol levels, high blood pressure, and diabetes, all of which are risk factors for heart disease. And finally, drinking too much alcohol can raise triglyceride levels. So triglycerides, that's basically a fancy word for fat that's floating around in your blood. And it can also lead to high blood pressure. This is drinking. It can lead to high blood pressure, heart failure, and increased caloric intake. So excessive drinking and binge drinking can lead to stroke. Other serious problems include cardiomyopathy, cardiac arrhythmias, and sudden cardiac death. So if you drink alcohol, do so in moderation, and this means an average of 1 to 2 drinks per day for men and 1 drink per day for women. A drink is considered 1 12-ounce beer, 4 ounces of wine, 1.5 ounces of 80 proof spritz, or 1 ounce of 100 proof spritz. So let's kind of talk about the difference between coronary artery disease and cardiac arrest. So most people don't know the difference between a heart attack and cardiac arrest. So as we previously discussed, a heart attack occurs when an artery that supplies blood to the heart is blocked. The heart muscle then starved of oxygen and dies. Cardiac arrest, however, is different. Sudden cardiac arrest is a condition when the heart suddenly and unexpectedly stops beating. When this happens, blood stops flowing to the brain and other vital organs. Sudden cardiac arrest usually causes death if it's not treated within minutes. Sudden cardiac arrest occurs when the heart develops an arrhythmia, also known as an irregular heartbeat, that causes the heart to stop pumping blood to the body. During a heart attack, the heart usually does not stop beating. However, a sudden cardiac arrest can happen after or during recovery from a heart attack. Sudden cardiac arrest affects men twice as often as it affects women. The major risk factor for sudden cardiac arrest is undiagnosed coronary artery disease. Usually the first sign of a sudden cardiac arrest is fainting, and at that same time no heartbeat can be felt. It usually happens without warning, and it requires immediate emergency treatment by use of a defibrillator. So this device sends an electric shock to the heart. The shock may restore a normal rhythm to the heart that has stopped beating. To work well, defibrillation must be done within minutes. And automated external defibrillators, more commonly known as AEDs, are special defibrillators that anyone can use. So these devices are becoming more available in public places like airports, office buildings, shopping centers, gyms. Often people who have had a sudden cardiac arrest and survive get a device called an implantocardiogram.